We are pleased to welcome Dr. Tsuyoshi Kaneko here from Brigham and Women's Hospital in Boston. He's a cardiac surgeon who's here to tell us about new discoveries and innovations in cardiac care. Dr. Kaneko, recently the FDA approved expanded use of a heart valve replacement option for patients if they need heart surgery. It's called TAVR, is that right?
It's actually, most of the people pronounce it TAVR.
TAVR, okay.
But it stands for transcatheter aortic valve replacement. And what it does, it's a minimally invasive method where you change the valve through the groin access under X-ray and avoid open heart surgery. Okay. So you can avoid crack opening the chest.
So you're putting a tube through an artery up the groin, piping that all the way up to the heart, the area of the blockage, ballooning up that artery and clearing the blockage.
That is correct.
Is it quicker than the alternative that a lot of people in the past were afraid of, the open heart surgery?
Absolutely. We usually get it done under 90 minutes. So it's very quick. And also a very, very safe procedure too.
Okay, that's the other thing I was going to tell you. When people hear open heart surgery in the past, it was very synonymous with risky.
Yes.
So
the FDA, when they first approved it back in 2012, it was only for a high-risk patients who were not eligible for an operation. But through reiterations of devices and multiple research, now last year they approved it for all-risk patients if anatomy is good.
Right.
And in those patients, the most latest research found that the stroke and the death rate, which is the most critical two factors, are about 1/3 of traditional open heart surgery.
You said in all these procedures that you've performed, you've seen a lot of patients who have felt immediate relief.
Yes, that is correct. It is quite satisfying.
Okay, and the balloon that we see there, it's all mapped out with an X-ray that you're looking at as you're piping this tube up there. It increases the size of the artery. You see it there, almost 3 to 4 times its original size.
That is correct. And as you mentioned, this is actual footage of the procedure itself on an actual patient. But once that balloon expands, the valve stays in place, and some of the patients get immediate relief from their symptoms.
Okay, and the alternative open heart surgery, I'm sure you've done those before. Is it less stressful for you to do one of these as opposed to an open heart surgery?
I would say that both of them are equally stressful because, we take care of the patient's lives. But at the same time, this one has immediate relief, and that is very, very gratifying.
So a newly approved, but for those who are interested, here in the state of Florida, there are options for them within the state?
Yes, they do. I would love to say to come up to Boston, to the Brigham, because we do have the large experience and the volume, but there are numerous centers in Florida that will be able to do this, and please ask your local cardiologist whether you're suitable for this procedure or not.
All right, thank you so much for making the long trip down here. Dr. Kaneko, if you are interested, again, go talk to your cardiac surgeon.